Welcome back to my channel, and in this video I'm going to talk about an important thing. I do have some other small videos on this subject, but I wanted to explore it and discuss it in way more detail, and that's where I am right now. And the condition is called hypertensive retinopathy, and look at the inside of the eyes. This is what it does. So what it is high blood pressure causes problem. Where does it cause problem? You can tell it from the name that it causes the problems in the retina. Retina is a structure inside your eyes, and that's where the damages happen from hypertension or high blood pressure. And that's the thing, that's the problem. It's a sign of a blood flow issue inside your body at other places as well. That's the important thing, that if you have hypertensive retinopathy, you have a higher risk of cardiac problems, you have a higher risk of brain problems, you have a higher risk of kidney problems, you have a higher risk of peripheral arteries or the veins of your body. So it's important. Here is some guidelines about your blood pressure and the stages. I have discussed those things in my other videos, so please check them out. The problem is, it does not just end in the eyes. That's what I'm trying to emphasize here, that you need to be aware of the complications of hypertensive retinopathy. First of all, let's talk about the eye itself. Yes, it can cause the swelling of a structure inside your eyes called macula. It causes macular edema. You cannot see because of that. You are blurry if your macula is swollen. That's what it means by macular edema. Another problem happens to the optic nerve inside your eyes, and that's what is going on here. The optic nerve is swollen. We call it as disc edema. Optic nerve is swollen because of the blood flow issues to the eye itself in this condition called hypertensive retinopathy. Another problem is it increases the risk of central retinal vein occlusion, central retinal artery occlusion, branch retinal vein occlusion, branch retinal artery occlusion, TRD, tractional retinal detachment. Some cases can get ERM, epiretinal membrane. Some people can get vitreous hemorrhaging is also possible because of that in the connection of this. Worsening of diabetic retinopathy. If somebody is already a diabetic retinopathy patient, they have a problem that this thing can get even worse. That's the problem, that if someone has hypertensive retinopathy on top of diabetic retinopathy, things go south, things get worse. Visual compromises from macular edema, papillary edema, or the nerve swelling that I showed you right here, they happen. The visual compromise is my problem here, because you don't want that. You don't want the visual compromise. So it depends how long will that last, depending on the patient to patient scenario and the extent of the treatment that is sought from this. Okay, so that's what I'm showing here as well in this video, in this picture here, and this is the angiography, the angiogram, the fluorescein angiography of the eye. The macula is swollen, the bleedings are happening, the eye is not looking healthy, both from the nerve perspective, as well as the artery and the vein perspective, as well as the macular perspective. The epidemiology and the risk factors are important to consider in this regard, because you need to know what you can do about it. The thing is, 4 to 8% of this hypertensive retinopathy happens in non-diabetics. So diabetes in itself can make it even worse than that. That's a very important point that you need to keep in mind. Common in adults who are above 40 years of age, common in the black race, unfortunately, and Chinese. Those are the two races where it is more common. And those people who have a history of coronary artery disease, including the carotid artery disease, they have a higher chance to get hypertensive retinopathy. So do have that awareness, do have that discussion with your doctor about it, okay? Tobacco, obesity, high cholesterol levels, diabetes and pre-diabetes, increased level of creatinine in your body, increased level of albumin or urine protein urea are important to know. These are important risk factors: high sodium intake, low potassium intake, alcohol consumption, obesity, lack of physical activity, and unhealthy diet. Those are critical risk factors, and there are things that you can modify. You can modify your salt intake, you can modify your alcohol, stop alcohol consumption, potassium intake, you can improve that, and focus on your diet and activity and obesity. Things can get better. And what are the signs of it? Look at this picture. This picture speaks in itself that yes, there is a lot of signs that you can catch it and get it referred, get it treated, get it addressed. Arteriolar narrowing happens. The arteries inside the eyes, they get narrow. The wall is thickened. It gets the thickening of the arteriolar wall, which is a sign of hypertensive retinopathy. Sometimes you also see cotton wool spots. They are small gray, yellow, or yellow-white spots inside the eyes. Microaneurysms are also possible. Hard exudates, which are yellow spots made of fats and proteins from the leakage of damaged blood vessels. Optic nerve head swelling, I showed you in the picture previously. That also happens. We call it as papilledema, and it is chronic in cases of hypertensive optic neuropathy. So be aware of those. Be aware of your staging and grading, that where you are at. It's very important to know those things. Grade 1 is where you have just mild arteriolar constriction. Then comes grade 2, which is worse, which means focal arteriolar narrowing plus nicking. You see some nicking there. Look at this picture. It's showing how the AV nick looks like. That's grade 2 hypertensive retinopathy. Grade 3 is even worse. You start seeing the hemorrhages, the hard exudates, and cotton wool spots. That's the problem. You see these exudates? That's how they look like. That's the problem. Look at this cotton wool spot. You see? So that's the problem. Those are important things to keep in mind. The stage 4, the grade 4 is important because that's where the things can get extremely serious and visually compromising. That's where, if somebody is coming with the visual compromise, that's where they come with. The first few stages, the doctor catches. The last stage, the patient catches. The nerve is swollen, the retina is swollen, the macula is swollen. Things are getting bad and bad. You don't want that. You don't want that because you don't want the visual compromise for your patient, and the patient doesn't want that himself or herself. Treatment and management. You need to understand your blood pressure, that where you are at, what you need to do, what's the goal, what's the ideal blood pressure. Have a sense of it. You need to know what to do and where you are at and what should you do next, because you have to take it seriously. Okay, weight loss is important. Limit the smoking and the drinking, and follow a heart healthy diet plan. That's important. Regular exercise is important. Okay, so you have to know your goals for the next 2 to 3 months and then go from there. Be in touch with your retina specialist if you are at the grade 4, especially at the grade 4. Even before that, I like to get in touch with my retina specialist so that they are aware, the patient is aware. It's a teamwork. It's a teamwork. One doctor may not be able to handle it. One patient is already going through a lot of problem, and so we have to have a teamwork. I always involve retina specialists beyond the stage 2, and especially the grade 4 that I discussed, the nerve swelling, retinal edema. We need a team effort because we don't want to lose the eye. We don't want to lose the vision. We don't want a blind patient. Not a single patient of mine wants to go blind, and not a single patient of mine is going blind because of me. I have to be responsible for my patients, and I have to educate my patients so that they are aware that what's going on and what they can do and what they cannot do. So things are serious here. Okay, if you have any questions, please ask me in the comment section, and it honestly helps if you like, subscribe, and share to my channel. Thank you. Have a great day. Bye-bye.